Hi, everyone. Thank you for joining us. We're glad you could make it. We're going to give about 2 minutes time for people to join, and we'll get started then. Okay, and one more minute, and then we're going to get started. Okay, good afternoon. I am Jonathan Lynch, a health communication specialist in CDC's Center for Preparedness and Response, Division of Emergency Operations. Thank you for joining us for today's CERC webinar titled CERC Overview for COVID-19. If you do not wish for your participation to be recorded, please exit at this time. You can earn continuing education by completing this webinar. Instructions on how to earn continuing education can be found on the webinar webpage. Go to emergency.cdc.gov and look under featured resources to find the link. The course access code is CERC0406 with all letters capitalized. To repeat, the course access code to receive continuing education is, in all caps, CERC0406. Today's webinar is interactive. To make a comment, click the chat button on your screen and then enter your thoughts. To ask a question, please use the Q&A button. The Q&A session will begin after our presenter has finished. Closed captions are available for this webinar. Note that this webinar will not focus on COVID-19 as an illness, nor on the virus that causes it, but rather communication practices that can help you communicate more effectively during any type of public health emergency, including COVID-19. To learn more about COVID-19, please visit the CDC website, cdc.gov/COVID-19. The website provides situational updates, best practices to minimize risk from the disease, and a contact form for submitting questions. Members of the media should reach out to media@cdc.gov with questions. Today, we will hear from Lisa Brasino, a senior health communication specialist with the U.S. Centers for Disease Control and Prevention. Lisa is an emergency risk communication professional, teacher, and environmental scientist by training. She is also a passionate advocate on behalf of those who face disproportionate barriers in accessing health, safety, and advancement beyond the barriers. Lisa has supported CDC as well as governmental and non-governmental partners in learning more about crisis and emergency risk communication and how to apply those principles during a public health emergency. She is actively involved in CDC's efforts to get accurate, timely, and relevant COVID-19 information to partners and the American public. She has played a similar role in numerous emergency responses, including the 2014 and 2018 Ebola outbreaks, the 2017 hurricane season, and the water crisis in Flint, Michigan. Lisa, please begin.
Thank you very much. First off, I want to thank everyone for making the time to join us today. This is an extremely difficult time for us, for you, for everyone around us. It's a time of fear and uncertainty, a time of tragedy. It can be easy to start to feel helpless or hopeless in this situation. But each and every person around the globe has a role in helping to slow the spread of this disease and eventually stop the outbreak. For some of us, that means taking the extra time to call a neighbor or a loved one to check in and see how they're doing. For some, it means providing health care or supporting the people who do. For many of us on this call today, it means sharing crisis and emergency risk communication, information about this outbreak in the best ways that we know how. I thank you so much for joining us. As Jonathan mentioned, this call is not specifically about the disease or about the virus that causes it, but rather communication principles that you can apply so that you can share information as effectively as possible. Next slide, please. CERC principles were developed many years ago. They were developed to help you, as someone who shares information, to provide the people with whom you're communicating, to provide the public with the information so they can make the best decisions. Emergencies always bring with them incredibly challenging time constraints. They also bring with them, especially in the beginning, a lack of information or a desire for more. And so when you apply CERC principles to your communication activities, you can help people to make the best decisions they can with these incredibly challenging time constraints, and also help them accept the imperfect nature of choice. Next slide, please. Because at CDC, we believe that the right message at the right time from the right person can save lives. Next slide, please. We're going to start with the 6 core principles of CERC. Next slide, please. So I'm seeing a lot of comments about adjusting the mic. I'm going to take a moment to adjust it. However, I apologize. That may make it more difficult for some of you to hear. So as professional communicators, many of you have probably already seen the 6 principles of CERC. We're going to take a few minutes to go through each of them. So next slide, please. The first principle of CERC is be first. If your organization has information and it's your responsibility to provide it, do so as soon as possible. We understand in this day and age, it is very difficult to be the very first one out the door with information. But the first message that people hear tends to be the one they remember and the one on which they base their evaluation of subsequent messages. So the sooner you can get accurate information out, the more effective you're going to be. If you don't have all the information, and chances are, especially at the beginning of an emergency, you won't, then explain what you're doing to get it. Next slide, please. The next CERC principle is be right. You probably immediately recognize the challenge between getting information out quickly and ensuring that information is completely accurate. But when you share accurate information, you not only help people to make better decisions, you increase the credibility of your organization so that people know they can come to you for that accurate information. Now, you want to be brief in these initial messages and stick to the main points. You certainly want to provide information, additional information as people seek it, perhaps in a website or other ways of sharing it. But you want to tell people what you know when you know it. So what we generally inform or share with people is as soon as you can, share what you know, what you don't know, and what you're doing to find out. Next slide, please. This slide, this third principle of SIRC, talks about be credible. That can be very challenging. Of course, people are going to want information from many sources. And sometimes it's difficult to know which information do people need first, right now, immediately. And sometimes officials can feel a sense of uncertainty about should we share this information at this time. But for the people seeking information, uncertainty is much worse than not knowing the situation. So even if at this time you have to say, this is what we're doing to find out, that will still increase your credibility as an organization that shares accurate information. And it will also help people better understand the situation so they can make the decisions based on the information that is available. And keep in mind that rumors are more damaging than hard truths. When public officials do not provide the information that people are seeking, people will look elsewhere for it, and there will always be those who are willing to provide it, regardless of their level of knowledge about the situation. Now, that is not to say that federal officials are the only ones with credible information. And in fact, we rely greatly on our partners, on other governmental organizations, on non-governmental organizations to share information. All the more reason why we appreciate you being here today. Next slide, please. CERC principle number 4 is express empathy. You want to acknowledge what people are feeling in words. This can build trust and can help people know that you have a better understanding of the situation when you demonstrate through your words, through your actions, that you have some sense of what kind of suffering they're going through, what kind of challenges they're facing. Next slide, please. CERC principle number 5 is promote action. When people take action to address the situation, it helps calm the sense of anxiety that they might be feeling. It helps to restore a sense of control. And in an infectious disease outbreak, people understanding what actions they can and should take to help slow the spread is key to stopping the spread of the outbreak. Not only that, but people also are going to take some sort of action based on the information available to them. When you provide them with the steps that will be most helpful to reduce the spread, stop the outbreak, and keep them, their loved ones, and their community safer, those are the steps. You make it easier for them to take those steps. As you're sharing those action steps, be sure to keep your action messages simple, short, and easy to remember. Things like cover your cough. Next slide, please. And CERC principle number 6 is show respect. This would seem to be one that would go without saying, yet it's one that in CERC we reiterate each time we share this information, because in the heat of emergency, it can be very easy to just try and get information out. And sometimes when you're working quickly, it can be challenging to communicate the right sense and tone of respect that you want to communicate. But respectful communication promotes cooperation. It builds rapport so that you're more easily able to share your information and so that people are more really willing to receive it. And this is especially important when people are feeling vulnerable, as they're apt to do during an emergency. You can think of it as always treating people the way you want to be treated, or perhaps even better, the way you want your loved ones to be treated, even when there are hard decisions to make and difficult information to share. Next slide, please. As I said, we wanted to take a few minutes just to cover the 6 core principles of CERC. Many of you are here today because you want to know how to apply these principles during an infectious disease outbreak, such as the one we're experiencing right now. And so these slides are available on the webinar website, and from there you can click on the link at the bottom to get to this fact sheet as a reminder as you apply SIRC in your current and future emergency risk communication activities. Next slide, please. We also, as we introduce the concepts of SIRC, want to talk about the SIRC rhythm. In every public health emergency, you're going to have different stages of the event, whether you're talking about preparation, initial, maintenance, or resolution. Throughout all of these stages, you want to keep in mind how critical it is. Do everything you can to engage the community, empower decision-making, and evaluate your efforts. At the very start of a response, or before the response even begins, rather, you want to develop partnerships. Find out who has the ability to share information with audiences that may be harder to reach. You want to draft the messages and test the messages. You may not be able to create messages for every imaginable situation, but you definitely should consider and do your best to create messages that will be useful for any type of public health threat that you can anticipate. You'll want to create plans for how you'll share messages, including coordinating with these partnerships you've built, and determine an approval process as new information develops, how you'll get those messages out the door. During the initial phase of response, that's where empathy is most key. You always want to be human, not just for communication purposes, but because you want to be able to really keep perspective on what's important in the response. But when you express that empathy in the beginning, you're opening doors for people to receive that information. As stated before, you'll also want to promote action, and you may begin describing the response efforts, because people want to know not only how do I keep myself safe, but what are you doing as a governmental or non-governmental organization to do your part to help people stay safer and healthier. The maintenance phase of the response is when the pace may slow or at least become more predictable. During that phase, you'll want to explain the ongoing risks. If you haven't already, you'll want to further segment your audiences, determine who is getting the information, who is not getting the information, and what are the best ways to reach all of the groups that do need the information. Now's the time to begin providing additional background information. And also, if you haven't begun to do so, to address rumors, to think more carefully about how you will address rumors. Finally, you'll reach the resolution phase. That is when you want to motivate vigilance. People can tire of hearing the same messages time and again. But chances are during this phase, they still need to take all the actions that you've been recommending, or at least many of them, to stop the outbreak, to reduce the harm. It's also the time to discuss the lessons learned and revise the plans for future events. Next slide, please. Now we're going to talk about the psychology of a crisis. When people are in a crisis state of mind, it is more difficult for them to receive and understand information. Next slide, please. So, during a disaster, communication efforts can run into many types of psychological barriers. One is denial. We've probably all seen news stories and social media posts about people who don't appear to realize how significant the threat is, or not believe that the threat is going to affect them. Right now, we're still learning more about COVID-19. And we know that it's going to take everyone participating, everyone doing their part to help slow the spread of this disease. People might also feel fear, anxiety, confusion, and dread. These are all very strong feelings that make it much more difficult to take in information and make it much more difficult to process that information so that you can make the best decisions. When these feelings grow extremely strong, they might turn into a sense of hopelessness or helplessness. These can possibly be the worst for your public health outreach activities, your public health response, because when people feel hopeless or helpless, they're less inclined to take the actions that are needed to help slow the spread of a disease or address a different public health emergency. One point I want to make here is that people seldom panic. We've all seen the movies about people running in the streets and screaming, but that doesn't happen in real life. People instead make the best decisions they can based on the information that they have available to them. And if they have incomplete or inaccurate information, then they're going to be more likely to make decisions that are not helpful to keeping themselves and their community safer. Next slide, please. So here are some things that you as a communicator can do to help people better receive and understand your messages. When people are in a crisis state of mind, they tend to simplify messages. So the more simply you can share the information that you have, the easier it will be for people to understand and remember it. People in a crisis state of mind also tend to hold on to their current beliefs. They've built these beliefs based on information that they had during a calmer time, and they're not very willing to let go of that foundation when things turn into a crisis. One of the ways that you can help counter that when there is new information is to use credible sources. Become a credible source yourself, but also share where the information that you're sharing is coming from, and work with partners who are also credible sources to share that information. In spite of the fact that people tend to hold on to their current beliefs, they also look for additional information and additional opinions. So by working with partners and by sharing consistent messages across all of your messaging platforms, you can increase the likelihood that people are willing to accept your information and are more easily going to be able to understand it. Finally, as mentioned earlier, with the Be First CERC principle, people tend to believe the first message that they hear. So from the very beginning and throughout the response, release accurate messages as soon as possible. Next slide, please. One point we'd like to make here is that not all risks are equally accepted. People tend to get more upset, more angry about a risk that they face involuntarily versus voluntarily. The same as whether that risk is natural versus man-made, or whether that risk is fairly versus unfairly distributed. We're seeing a lot of these principles in this COVID-19 event. This is a new disease. It's exotic. People are more interested in it, but also maybe experiencing more fear because of it. Nobody is being voluntarily exposed to COVID-19. So this involuntary aspect of the risk exposure is also going to make people more concerned about it. Next slide, please. So here's some more things that you can do to help counter the psychological barriers that may impede your ability to get messages through. First off, as we mentioned before, expressing empathy. Acknowledge that people are feeling fear and uncertainty. Express wishes. Of course, not every wish that comes to mind, but show understanding that you also wish that you had the answers that people are seeking. Do be cautious not to over-reassure. While CDC and the federal government have recommendations, about how long you should take steps to minimize your exposure to COVID-19, we can't say for sure when the threat will be passed. So don't attempt to give any kind of guarantees about timeline or any other kind of reassurance that you cannot offer without strong evidence. You can explain the process in place to find answers. That will provide some sense of reassurance. Also promote action. Interestingly, the data show that during a crisis, people are much more willing to help, to do their part, and to help others. So now is the time to ask more of people. And when the news is good, you want to state the continued concern before stating the reassuring updates. We know that there is very, very challenging situation going on in the state of New York now. And over the weekend, Governor Cuomo spoke to the fact that there was a little bit of positive news. But first, before he shared that positive news, he gave accurate information about the current state of affairs and was very, very clear that this little sign of good news was not the end-all be-all, that more information is needed. Next slide, please. You also want to develop and tailor messages. We talked earlier about segmenting your audience, identifying the different groups of people who need to receive the information. Next slide, please. In tailoring your message, and developing your message, you want to definitely use plain language. Be brief. You may have a lot of information to share, but focus on what do people most need. Of course, help them to find the information that they're seeking, the additional information. But be as brief as possible and help them to, from that point, then find the additional information. You also want to give positive action steps. Do statements are much more effective than don't statements. Use words your audience uses. Quite often, when you're trying to communicate with a broad audience, you're going to want to use simple, everyday words. This in no way implies a lack of sharing information, but just in the phrasing that you choose. But also consider that audience. For example, laboratorians are going to use a different set of words than you or I might use every day. Finally, use personal pronouns. A statement such as "cover your cough" is going to be more effective than "coughs should be covered." If you would like more information on how to apply these steps, you can check out CDC's websites on health literacy and the Clear Communication Index. Of course, there is a broad range of information available on how to communicate clearly, but these are just a couple of resources that I find particularly helpful in these activities. Next slide, please. Now let's talk a little bit more about what tailoring messages means. You want to identify your audiences, but also the groups within those audiences. While you may catch me using the phrase general public from time to time, the truth is there is no such thing as general public. People are diverse, and their information needs are diverse, and their styles of taking in and processing information are diverse. So you want to consider who are the groups, not just people as a whole, who need the information. You'll want to continue to base all of your messaging on key messages. Identify what are the core pieces of information that people need. And then from there, work on considering the role of culture, the role of linguistic ability, the role of language preference, the role of health literacy, preferred communication channels, all sorts of ways that you can consider how can I most effectively get the information out. Next slide, please. As you develop your messages, work with others to share those messages. As stated a couple of times now, when possible, establish those relationships before the emergency starts. As you have identified the different audience segments, think about who is best poised to reach those audiences. Who do those audiences trust? And establish relationships with those organizations. Also, as you share messages, it's important not just to think about what information do I want to push out, but what can I learn from my partners? What can they tell me about the information their audiences need? What can they tell me about the best ways to get information? What can they tell me about who is not getting information? What misinformation might be out there? And the best ways to counter the misinformation as well. Next slide, please. You also want to promote repetition and consistent messaging. You've heard me speak a few times now referring to consistent messaging. Consistent messaging does not mean using the same exact words time after time. What it does mean is keeping to the same key ideas. Now, of course, as the situation evolves, you're going to have new and additional messages. So, of course, early in the response, you want to state that up front. You want to be very clear, we're learning more and we will share information as it's available. You want to be very clear, these recommendations are based on early information. As we learn more, recommendations may change. But you want to be consistent in the information that you do share. The examples we're looking at here show that everyone has a role to play to reduce and slow the transmission of COVID-19. You can see that not only is this a CDC message, but a message from the White House as well. So you want to also coordinate your messaging with your response partners. Now, different partners may have different areas that they specialize in. And so, of course, for example, after a hurricane, FEMA may have one set of messages and CDC may have another. At the same time, we coordinate to ensure that we're not giving conflicting guidance, but rather that we have a clear understanding, and so our audiences have a clear understanding of where they should go to seek the different types of information. Of course, in a response such as this, where the whole of federal government is involved, we're going to all coordinate to try and provide the best information possible to all of our respective audiences. Next slide, please. Next, we're going to go over a few more effective practices for improving communication. I want to caveat by saying CERC training is usually at a minimum several hours long, often a full day, and occasionally longer. So, with the next slide, please. I'm just going to take a few minutes to quickly go over some of the takeaways from the various units that we're not going to cover in depth today. Next slide, please. We do recommend, when employing CERC principles, to select an effective spokesperson. As you've seen on many of the briefings available to the public, sometimes that will mean having more than one person present to share information, whether we're talking virtually or in person. But all the spokespersons involved in a response and sharing public health emergency information should avoid humor, speculation, and condescension. Now, some of these you're looking at and thinking, very likely, of course, that's obvious. But during an emergency response, some people have a coping mechanism of going to humor. When you're communicating with large groups of people, that is not the time. They are not in a humorous state of mind, and your humor will not be well received. Also with speculation, as we referred to before, do not over-reassure. Share what you do know, what you don't know, what you're doing to find out. And condescension. We want to always treat all people with respect. As a spokesperson, you also want to refute negative allegations, but avoid repeating them. You might use a phrase such as, "The point we'd like you to take away from this discussion is," or perhaps, "Some people are hearing conflicting reports. Here's the information we'd like you to have." Spokespersons want to use plain language. Spokespersons are usually quite knowledgeable in the topic that they're speaking about. And it sometimes can be a challenge not to share as much information you know or use language that's common to you, but may not be everyday language. You'll want to stick to the main points and also remember what you say is never ever off the record. Next slide, please. You'll also want to set up positive relationships with the media. Just like you set up your partnerships during the preparation phase of a response, you'll want to connect with media outlets to the best of your ability before the emergency happens. Even so, new relationships often form during an emergency. So you'll also want to establish those relationships as early as you can. You want to be fair in the information that you provide, and you want to be sure that all audiences are getting the information they need. So provide the same information to all the media outlets and provide options so that they have as much access to the information as possible. You'll likely need to give a time frame. You probably won't be able to respond to every media outlet's request for a one-on-one interview. But what you can do is set expectations about when you will provide an update. Finally, make accommodations. Understand that media outlets are under extremely tight deadlines and do what you can without compromising your role in the response to accommodate their requests. Next slide, please. You'll also want to listen and evaluate. You're going to take a look at the media and social media. I want to be very clear. This is not listening into private conversations. Rather, this is taking a look at the big picture. What's going on out there? What are people saying? What are people worried about? Are they receiving any misinformation? As mentioned earlier, ask your partners for feedback. Ask others for feedback. Be willing to accept that feedback and consider how it can influence and make better your communication strategy. Every opportunity that you can, use rapid message testing. As we talked about earlier, pre-event testing is the ideal time to get information to refine those messages. But when you are actively sharing those messages during a response, do what you can to make sure those messages are developed, written in a way that is understandable and usable. And analyze other available data sources. You might look to see which web pages are getting the most hits. You might take a look at the inquiries your public information hotline receives. Find out which questions are most common. Those will help inform where you target your efforts. Next slide, please. And here we'll talk about 5 communication mistakes to avoid. It can be very challenging to avoid mixed messages from multiple experts, especially when there are so many unknowns. So do the best that you can to coordinate so that when you share information, when the other organizations share information, that you're sharing consistent messages. Another common mistake is information released late. Early on, we talked about how challenging it can be to get accurate information out quickly. So do the best you can. And when the information is not yet available, share what you're doing to find out. Avoid paternalistic attitudes. When you know the information that you have to share, the recommendations that you have can help to save lives. It's important to be mindful that people are going to choose for themselves based on what applies to their situation. So just be mindful and avoid paternalistic attitudes to the every extent that you're able. Another mistake is not countering rumors and myths in real time. Now, when you're considering your social media strategy, you're probably not going to want to answer every single response that comes into your post unless it's going to be helpful for sharing information. But what you do want to be mindful of is which rumors are out there, which myths are growing, and how can you as a communicator best address those. Finally, avoid public power struggles and confusion. There may be disagreements about who should speak first, who should speak loudest. But what you can do is you can coordinate so that those sorts of issues are resolved before you go in front of mass media, before you get out in front and share all of the information that you can share, because you do want to share the information and you want to share it quickly, but you don't want your message to get buried in the power struggles. Next slide, please. As I mentioned, this was a very quick overview of much of the ground that CERC training covers. I expect that many of you will want to know more about how to apply CERC in your work. If you visit emergency.cdc.gov/CERC, you can find not only the CERC manual, but many other resources that can help you apply these principles to your work. If you don't find what you're looking for, we do invite you to please send your questions to circrequest@cdc.gov. We do know when we share information via webinar, we get many questions regarding how to receive the continuing education information. So Jonathan mentioned it at the beginning, and here it is again, that you can go to the website and click on the 9 easy steps and use course access code CERC, that's CERC 0406, to receive continuing education. Next slide, please. And with that, we'll start our Q&A.
Great. Thank you, everyone. First of all, I want to say we've had a lot of comments about the microphone issue. We actually, just right before the session, did test it and seemed to get it to work properly. And then now somehow when we're live, it's not working properly. So such is life, I suppose. Lisa, we have a theme going from several of the questions I was hoping you could address, which is that several people have noticed that there has been different communication around the issue of masks and perhaps some inconsistent communication in other areas. Can you talk about the need to address changing messages as the science, as the knowledge advances?
Absolutely. We do want to acknowledge that recommendations have changed over the course of this event. Each time we provide a recommendation, it's based on the best information that we have available at the time. So, for example, the recommendations regarding face coverings. I hope many of you have seen the Surgeon General's short video on how to make your own face covering, and that you can easily find the information on CDC's COVID-19 website on the recommendations regarding face coverings. You'll notice that I'm using the term face covering versus mask. That's to avoid some of the confusion. There is confusion about which word makes the most sense to use. But going back further into the question about the different recommendations, again, this is an evolving situation. We're providing the best information we can as we have it, and we're working with many, many partners to get that information, to develop those recommendations, and then we all consistently share those recommendations. Next question, Jonathan.
Great, thank you. Can you speak to the need to balance out respecting privacy versus respecting the need to tell people what's going on?
We take great pains to protect the privacy of any source of information related to this event. There are many systems in place to collect data, but to ensure that people's personal data is not shared. When CDC shares information, you'll find that it does not provide personally identifiable information. But what we do is we try and take a look at the big picture, because we do need to know what information do people need? What information are they lacking? Is there any misinformation circulating? So, Jonathan, I don't know if you want to clarify the question any more beyond that.
That was kind of the best summary I could give of it. But it's an important topic because sometimes, a single person may get sick, for example, in a given area, and we can't, as public health communicators, we can't give away that person's personal information, while at the same time we're having to tell people, hey, yes, it has now made it to your region. And so that's just kind of a delicate balance there.
Absolutely.
I think, so the issue of panicking, because the word panic seems to have different meanings for different people. Can you explain in greater detail what is meant by panicking? And can you tell us if hoarding would be considered a form of panicking?
Well, I'll go back to the statement earlier that people seldom panic. But what they do is they make the best decisions they can based on the information that they have available to them. So many people, especially a couple of weeks ago, but even now, ran out to buy lots of supplies in anticipation that they would have limited ability to go out, to go to stores, to go to other public places. And so they made the best decisions they could based on the information they had available at the time. So when we're talking about panicking, what we're really talking about is people, instead of processing their thoughts and making decisions, just reacting, and generally in ways that can be harmful to them and others around them. So to answer your question, no, I would not call the hoarding that we saw an example of panic, but rather people making decisions they thought were going to be best for themselves and their families.
And we're not saying that's a good idea, because clearly everyone should have access to toilet paper, not just those who went out and bought a lot of toilet paper ahead of time. But it is understandable why people would make that choice. And even if it's inconsiderate, is not an example of panicking. Um, the question is, what is meant by providing options to the media? And can you give some examples of options that one can provide to the media?
Yes, definitely. You can provide the media with options about how they're going to get information from you. For example, there are many, many news briefings going on, and media are invited to attend in person or virtually those briefings. But in addition to that, for example, CDC has a digital press kit. You can go to CDC's media website, and if you're a journalist, if you are a news person, you can go to that website and you can find information that will be helpful to you so that you can get the story out. Not just the same general information that is on CDC's website. Of course, it's consistent between the COVID-19 website and the digital press kit, but things that will help you better present your story to the public.
That's great, yes. And we have found the press to be very responsive to those efforts as well. So given the current crisis and the likelihood of moving to crisis standards of care, strategies that one uses when one is in a heightened crisis, what advice would you give in that difficult situation, especially with regard to managing the social media around those issues? And just a little bit of interpretation. I think what they're asking is, given that there may be some high stress around the idea of not being able to provide enough care for everyone, how do you message around that?
I think one of the important things to keep in mind when you have to message about such difficult things is expressing empathy. Recognize that this is a very difficult time for everyone. Recognize that difficult choices have to be made by everyone involved in the response, including everyday people in their homes, choosing to keep themselves and their loved ones safer by not going out any more than is necessary. In addition to expressing empathy, you want to do everything you can to provide the information clearly. Again, recognize that people are going to make their own decisions about how they're going to respond to this event. But the better access they have to information, the more easily they're able to understand the information you have to share, the better equipped they are to make the decisions that will keep themselves, their loved ones, and their community safer.
Great, thank you. I'm gonna move on. I had saved some of those questions down, moving back to the Q&A section here. One anonymous attendee who is a psychiatrist is saying, I'm telling you, people panic. I just want to explain, well, we're not saying panic never occurs under any situation, but in situations like this, if you look at the behaviors of the large majority of people, panic does not describe that behavior. So next question. I live and work in a small town. We have had requests for case counts. I've had concerns about sharing that information as the number is low and I don't want people to take too much reassurance from small numbers, and also the implications of privacy of case count numbers in a small community. Can you comment on that?
Certainly. I first off want to acknowledge that's an incredibly challenging situation. I think in a situation like that, you do have to continue to be mindful of privacy concerns, to do your best to protect the privacy of the people who are most directly affected by this and experiencing illness from it. So what I think that would be helpful is to continue what you're probably doing, which is being very forthright about sharing information about why this is a threat and what every member of your community can do to help reduce the threat.
That's great. Here's another question. Hi, I live outside the United States. All the information given here is very nice and helpful. Can the guidelines here be applicable for any country?
Yes, we've put a lot of effort into attempting to determine how relevant CERT guidelines are in different cultures and different countries, and all the evidence that we have to date shows that yes, the general concepts of crisis and emergency risk communication are applicable in other cultures and other countries. One thing I do want to caveat with that, however, is that as a communication professional, you'll want to be mindful of what is culturally relevant in your country. So take the CERC principles as a beginning, but as you're tailoring and adapting messages, as you're developing or refining that communication strategy, do ask yourself what works here and give credibility to your own expertise and expertise of your colleagues on what's most effective for your communities.
Just going to follow up on that. The first rule of writing is write to your audience. Someone should say the second rule of writing is have somebody from your audience read it and tell you if that message actually works. So, but yes. Okay, so the next question, how can the necessary trust be established for an organization in the flurry of media hysteria? That is, I guess it's relating to building trust at the last minute, when ideally we would build it ahead of time.
Okay. Well, as we talked about before, if you can get accurate messages out quickly, you're going to increase that trust. Whether you're talking about with media, with members of the various audience segments that you've identified, with your partners, the faster you can get accurate information out, the more credibility you're going to build. And when you can't say what exactly you anticipate will happen, what you can say is what you're doing to get more information so that you can share accurate information and so that you can anticipate what may come.
Great. Okay. So Arthur Lapian asked a question. In a state of panic, can we guarantee that the audience can receive our message well? And just to add to that, also when people are in a heightened state of stress, how can we make sure they will receive the message?
Okay. I'll first start out by saying if people truly are in a state of panic, my apologies that I do not have the credentials in psychology or psychiatry to speak well to whether the message or how the message is going to get through. But what I can tell you that even when people are in a crisis state of mind, applying all the CERC principles that we've covered in this webinar will help to get the message through. There's no way to guarantee that every single message is going to get across to every single person. But what you can do is apply the CERC principles to increase the likelihood that the message is going to get through, not only be received, but also be understood, and ultimately, hopefully, to be applied to the decision-making process of each individual.
Okay. We've gotten several questions here about how can we tell people how to go make their own masks. That's outside the purview of this presentation. So I just wanted to tell people that.
I'll add though that if you go to CDC's website, you can find that guidance. I believe it's even flagged as new up on the top of the webpage.
Thank you. Do you agree it is important to accept that in the absence of official information, people will listen to unofficial sources whose information may be far less scientific, even if taken to be credible?
Absolutely, they will. That's why it's so important to be one of the first ones out there with your message, even if your message is, here's what we know, here's what we don't know, here's what we're doing to find out. My apologies if those of you on the call are tiring of this phrase, but it's one that we rely on and have found incredibly useful and have heard from partners as also incredibly useful guidance over the years.
How would you clarify the difference between a recommendation and an order to comply?
So I would imagine there are probably many legal nuances related to that I am not qualified to address. However, as public health agencies, you certainly can make recommendations, encourage people to make the decisions that will help them to be safer.
Okay, this is a great question. When an emergency is widespread, such as this, how should local officials respond without simply repeating what is said nationally and convey that they understand the emergency and aren't just repeating what has been said? People would like to have confidence in their local leaders.
Absolutely. And I'll go back to a couple of points that we've talked about. One is the consistent messaging, but again, consistent messaging does not imply using the same wording, phrasing, ideas. It does imply avoiding any conflicting information. And so, yes, take the information that is available about the national level, but also consider the information that is available to you as a local official and share that information as well. Consider the needs of your communities, the unique aspects of your communities. How would they most likely like to receive the information? Who do they trust to receive information? What are their go-to sources to get information? And use all of those as you consider what to say, how to say it, and how to share the information.
Can you talk about stamina and keeping up with the duration of the crisis, and especially communication efforts to encourage people to keep doing what they need to do, even when it's challenging after several weeks?
I certainly can. One of my recommendations would be to consider the needs at the moment. I'll go back to several years ago when I arrived in Liberia for the Ebola response. And when I arrived, there had been very little spread of Ebola in almost every place in Liberia. So when I arrived, the appropriate message for the entire country was not Ebola is spreading, but rather continue the practices that you need to practice to ensure Ebola doesn't return to your community. I use that example to explain in this context. We want to be mindful, what is the new information? There is new information almost every day about this outbreak, but ultimately we need people to take many steps to help slow the spread and stop the outbreak eventually. So think about ways that perhaps you have not already framed the message, channels you might not already be using, and think now about how to share the information that's relevant now, but do what you can to anticipate, how am I going to share the information as, for example, the spread does slow in my community, or as, for example, the threat heightens in my community. So that the messages, many of the messages are going to stay the same, and it will be a big challenge to figure out how to share those messages in ways that people just don't tune out. And in those cases, again, with consistent messaging, you're just going to have to think about, what ways have I not already used? What communities have I not already reached? And how can I share this important information in a way that feels new and different so that more people are receptive to receiving the message?
This question is from Caitlin Suganaka. Do you have recommendations for alternative channels to push consistent messaging out to teens and families with teens? Our information is likely consumed most by adults, but we aren't reaching a younger audience as consistently.
Well, I think that's incredibly smart of you to recognize that teens, that younger people are going to have different preferred ways of receiving information. They're going to have a different perspective on how the threat presents itself to them. And so while nothing's going to be true of every group of people, we do know, for example, social media is a good way to reach younger people. Now, we know that adults tend to be more users of things like Facebook and going in the direction with Twitter as well. But what channels are the teens, the young adults using? Look into that. I hesitate at this time to say which specific channels because I don't know enough about your specific audience, but we do know that other social media channels are very effective for reaching those groups. I'd also encourage you to check out CDC's website for more information that may be more relevant to these groups, to younger adults and teens. And even children. We're continuing to develop more information, including recently we posted information about how to talk with children about this situation. That information can be relevant for kids. It can also be relevant for teens. And take a look at the other information that's out there. I'll be a little bit frank, and I've came across on my personal information sources, information that was developed obviously for young children about how to deal with this event. And honestly, I printed off that resource and I'm sharing it with my daughter so that we can spend time talking every day about how she's feeling about the event. So as a communicator, sharing the information, sharing the resources that will help the adults share the information with kids, but also going where the kids are going for information.
Thank you. Next question. I work at a county jail. Management communicates through email. I found this to be ineffective because many staff have questions and need to discuss the expressed information or directions given. What formats to give information work the best?
That is going to depend very much on your audience. Of course, at CDC, we're doing everything we can to get the information up on the website. We're also sharing key messages and key points with partners. And the reason we develop those is so that communication professionals across the nation can take that information and can adapt it to fit their audience. So again, it's going to depend on the audience, what the best way to reach them is. And each of us as communication professionals needs to consider what are the different audience segments we're trying to reach.
And one of the things we do, to follow up on that, we we'll try a number of different avenues, a number of different communication modalities, and just kind of get feedback and see what works. I mean, just test and try different things. That seems to be helpful. Okay, still looking for some more questions here. How do we communicate in a way that keeps people's spirits up? Because if they feel hopeless, they may not change their behavior.
Uh, Thank you for that question. It actually gives me hope to think about those sorts of things. I think one of the most important messages you can communicate about that is that you can make a difference. Communicate that message to each and every person. You have a role. You can make a difference. You can take steps to protect not only yourself, but your loved ones and your community.
Lisa, we seem to have lost your audio there momentarily. The next question is from Joy Ann, who asks, can you add the dimension of leadership to these pointers? For instance, in giving guidance to residents and their families, as well as staff, can you note, say, specific pointers that go to leadership and motivation?
Absolutely. A lot of the key points that we touched on for spokespersons are also going to be points for leaders in general. You do want to, as a leader, express empathy. You want to not only show that empathy, but have an understanding of what people are feeling. You also, in spite of the level of expertise that you carry, may need to take steps to be mindful of using clear, plain language. You also want to do what you can to be encouraging, to tell people, as I mentioned with the last question, that they can take steps to help slow and eventually stop this outbreak. You can also consider what are the needs of the people who are looking to me for leadership. And that's whether you're talking internal or external leadership. You do want to think about what do they need. One of the things that I actually talk about quite often here as CDC is that we also need to ensure that we're meeting the needs of as many people as possible, including those who work at CDC. So the same is true for your organization. What do the people in your organization need in the way of leadership, in the way of communication, so that they can be as effective as possible in fulfilling their roles as emergency health responders?
How do we prepare our families with school-aged children to return to school? Young children might still be scared. They might want to wear a mask in school. We might see an increase in bullying.
So, those are things that we do need to think about at this time. We don't have a lot of information at this time about when kids might be able to return to school. But what we can do is use some of the same practices that we've been using all along, considering them as an audience, considering them and their needs, where they go for information, and then applying these same principles to share that information with them. That may not take away all the fear. It probably won't. But what it can do is help equip the parents and the teachers to be able to have the information they need and to be able to express empathy on their own parts. I know many of us as parents, as teachers, we do that naturally. Probably all of us as parents and teachers will do that naturally with our own children. So we just need to continue to consider that, to consider the information needs, but also be mindful of the mental health effects of this event. This is such a hard time for everyone, and it's going to continue to be a hard time for quite a while, even when the immediate threat of the virus is past. And so CDC does have some information on how to cope with it, and that information will also continue to evolve as we learn more and as we reach different stages of the response. And so as public health communicators, you could look to our website for a little bit of information on how to help kids adapt to going back to school as we get to that point in the response, but then also consider the needs that you have a better understanding of because you're more directly connected to those communities.
Does shaming, does shaming of people's selfish behaviors such as hoarding of scarce resources, change individuals' behaviors?
Not normally. Taking a negative approach to sharing information or encouraging a behavior does not tend to actually result in the positive behavior being exercised.
It looks like we're kind of running out of questions that are on point here. Many of them are going into other directions that aren't covered by this webinar. So I'm going to go ahead and read our closing information here. Thank you again for joining us. If you have additional CERC related questions, you may email them to CERC request, that's C-E-R-C request, R-E-Q-U-E-S-T at cdc.gov. As a reminder, today's presentation has been recorded and you can earn continuing education for your participation. Please follow the instructions found on the emergency.cdc.gov website. You can find the link to the webinar under featured resources at the website. The course access code is CERC 0406 with all letters capitalized. Thank you everyone very much for joining us, and thank you, Lisa.
Thank you.
Goodbye.
Bye.